Good morning, everyone. My name is Daisy Ortega, and I work here at the Community Health Training Institute. I want to welcome you all to our Prioritizing Youth Voice in Public Health efforts. We're going to give people a couple minutes to sign on. Thank you so much for joining us this morning, and we'll get started in about 5 minutes. Thank you. Good morning, everyone. Thank you all for joining us at our Community Health Training Institute webinar. My name is Daisy Ortega. I serve as the director of the Community Health Training Institute, and we're really excited to have you join in this wonderful webinar on prioritizing youth voice in public health efforts this morning, presented by Carly Caminetti, Natalie Cashin, and a guest appearance by Evelyn Rodriguez, and we'll hear more about her work in Lawrence. So we have a wonderful webinar for you all today, but we do want to walk you through some information before we do that. So again, this is the Community Health Training Institute, and this webinar is brought to you for free by funds provided by the Massachusetts Department of Public Health. So we're appreciative to them for that resource. So I want to walk you through how the webinar is gonna work today if you haven't been part of a Zoom webinar in the past. So you will have an opportunity to ask questions at the end of the webinar, but also during, if you type them into the question box, and I will show you what that looks like in the next screen. You will also be able to chat with the panelists if you have any comments or thoughts you want to share with them throughout the presentation. And of course, like I mentioned, we'll give you an opportunity to share those questions at the end. There will be about two polls that will be shared with you all, and or a couple more, so that you can share your thoughts about what you are hearing in the webinar, as well as giving your feedback on how we're addressing the learning objectives. So please keep an eye out for that and be at the ready to fill that information out for us. And also, a couple days after today's webinar, we will follow up with a link that will include slides and the recording for today, so that you can reference it in the future and also share with others. Also, we welcome you to use Twitter and hashtag MA Coalitions to share any thoughts or questions or shout outs you want to do during the presentation today. Our handle's right there on your screen, and we welcome you to follow us and chat along with us. As well. So as I mentioned, here's what it's going to look like if you have not attended a Zoom webinar before. At the bottom of your screen, you're going to see 3 images. So you will have an opportunity to ask questions where everyone will see those questions through the Q&A. I apologize. So the presenters will be able to see the questions if you type it into the Q&A. And the chat function gives you the option of just chatting with the panelists or with the rest of the attendees. So you have the option to do either or. You are also welcome to raise your hand if you want to get our attention, and someone from our team will make sure to reach out to you. So again, please feel free to get familiar with those buttons so that you know what is coming up. And now I'm going to pass it off to our wonderful presenters to go over the objectives and get the webinar started. So thank you all again for joining us today.
Hi, everyone. We're just going to pull up our slideshow here for you in just one second. Okay, good morning, everyone. So our learning objectives for today will be to identify levels of youth participation. We'll also be naming strategies for engaging youth in every step of the process of promoting policy change in particular. And we'll also be identifying best practices for engaging youth in community health work. So by the end of this presentation, hopefully all of these will be met. So the first question is, who are we? My name is Carly Caminetti. I use she, her, and her pronouns, and I work with Health Resources in Action, and I run the 84 movement. I'm the program manager for the 84, which is a teen tobacco prevention program that's funded by the Massachusetts Department of Public Health. Specifically within the Department of Public Health, there is a bureau, and within that bureau, there is a program called the Massachusetts Tobacco Cessation and Prevention Program, or MTCP. And we've been working with them since 2007 on this particular project. So they fund our organization to run the 84 movement. Massachusetts, or MTCP, or the Massachusetts Tobacco Cessation and Prevention Program, is a program that is funded through the Department of Health, and also they have a lot of different components throughout the state where they really work on tobacco cessation, control. They run the Smokers Helpline and have a lot of different programming like the 84 movement, which is specifically for young people. They also run the state's smoke-free helpline, as well as smoke-free housing initiatives across the Commonwealth. The website for MTCP is makesmokinghistory.org. I really encourage all of you to go and check out the website. It is chock full of resources for school administrators, for people who are just looking for information around smoking and vaping. They recently put out a toolkit that is full of information and different downloads that people can use throughout their communities. You might have seen there's a big ad campaign right now called The New Look of Nicotine Addiction. And this is just one of many initiatives that MTCP does in order to do outreach in the community and make sure that the message is being heard. You'll hear a lot about vaping and tobacco in our presentation because that's what our program focuses on. But we will be talking about involving young people in our program in policy, specifically in that niche. The things that we talk about, though, can be applied to any public health issue. So I know that many of the people who are on this webinar today don't work in tobacco, and that's completely fine. So I encourage you that as we go throughout this presentation, just kind of think about your own program and your role within that program and see where you can use some of the information that we're presenting and apply it into your category of work.
So thank you, Carly. So my name is Natalie Cashin, and I'm the training manager for the 84 movement. So I work a lot on specific aspects of our program related to training and mini grants and things like that. So I'm going to give you a little bit more of an in-depth look about how our program is structured. So as we go through this presentation and we're giving examples of the way that we engage youth, sort of understand the way that our program works. So as you can see by the graphic here, we have 5 different sort of main aspects of our program. Mini grants, where we're giving, small amounts of money, between $2,000, maybe up to $5,000 to chapters in order to participate in specific projects in their community. We have statewide events such as our Youth Power Summit in the fall and an event in the spring called Kick Butts Day, where we bring young people to the State House to meet with their legislators. We have a statewide leadership team, and this is made up of a specific group of young people from our chapters all across the state, and they're the ones that sort of help us organize our program and make decisions about our program from the sort of youth perspective, and I'll talk a little bit about them more in a minute. As I mentioned, I'm our training manager, so we do a lot of trainings around tobacco prevention. We also have trainings around racial justice issues and how to prepare to participate in local policy efforts. And finally, we have various different activities and opportunities that we provide to chapters throughout the year to become more engaged in their community. And like Carly mentioned, a lot of that revolves around local policy work. We really focus a lot of our program on the fact that the tobacco and vaping industries are the ones who are at fault for youth initiation of tobacco products, and that it's not really about discussing individual use or how young people are using these products, but it's really focused on helping young people get educated about how the tobacco and vaping industries are targeting them. And so that's really where we place a lot of our energy in our programming. So as I mentioned before, we have a statewide youth leadership team, and this is a picture of some of them helping us prep for one of our events. And this is a group of young people that really is an extension of our staff on the 84. We meet with them online virtually every single Sunday, and we meet on a variety of topics. It could be asking them to help us make decisions about different program things that we want to do, understanding how we might want to tackle social media efforts, how to plan an event, and helping them sort of run our statewide events. But it also could be just an opportunity for us to give back to them and do workshops around how to prepare for college or how to deal with peer pressure, all kinds of different things. But really, we do see them as an extension of our staff, and we really do reach out to them for almost every decision that we want to make within our program. So this is really an opportunity for us to engage them and really focus on that effort to center the conversation around the tobacco and vaping industry and empower these young people to fight back. So before we move on any further, we're going to do one of those first poll questions that Daisy mentioned in the beginning, just so we can understand sort of where you all are at in terms of your work with young people. So the poll question is, do you currently work with youth in your coalitions or in your programs? So go ahead and answer that now, if you please. We have some answers coming in. We'll just give you all maybe another minute to submit your answers for that. Great. So it looks like we have our results up on the screen here. So it looks like a lot of you have young people involved at least some of the time in your coalitions or in the work that you're doing in your communities, which is really wonderful. It's great to see that coalitions and other projects are really trying to look for ways to get youth involved. And for those of you who said that they're not involved right now, hopefully through this presentation, you'll get to hear about some ways that you maybe could start to get young people involved in your work and what that benefit could be for you all. So now we're going to switch gears just a little bit. And I know Carly mentioned before that some of you might not be working in tobacco specifically, which is totally fine. We just wanted to give a little bit of background about where we're at as a program and talk about where we sort of are in the state when it comes to youth tobacco prevention. So we want to go over some of those statistics with you before we continue. So in this first graph here, this is depicting the current use of tobacco products among high school students in Massachusetts. So what we see here is that a lot of prevention efforts that we've done over the last 10 years, including the 84 movement specifically, has really been working. So when we started the program in 2007, we were called the 84 because 84% of youth in Massachusetts did not smoke cigarettes. That number has now gone to 93% of youth do not smoke cigarettes. So it's clear to us that the prevention efforts we're putting in and the work that these young people are doing in the state is really making a difference, especially when we're talking about cigarette use. But for those of you who are familiar with tobacco use or are familiar with this topic, you know that that's not where the whole conversation ends with cigarettes. When we're talking about other tobacco products, especially vapes or e-cigarettes, we see kind of a different story. So we can see from this graph here, when we break it down in terms of the type of tobacco product we're looking at, we can see a huge difference from smokeless tobacco to cigarettes to cigars. And as you can see here, the highest used product by young people, electronic nicotine products. Now, when we say electronic nicotine products, what we're talking about is all of the things that you might think about. We're talking about e-cigarettes, vapes, hookah pens, all of those different products and names for them are all encompassed in this one category. And as we can see from this graph, there's a stark difference between the number of youth using these products versus other, maybe more traditional products like a cigarette. And here again, you can see that difference even more pulled out from any tobacco product and just like the electronic nicotine products. So this is why the Surgeon General and the FDA Commissioner have come out and said that this is an epidemic. This isn't just happening in the state of Massachusetts. This is happening all across the country. And we're seeing that here in these numbers for us in this state. So it's really something that's important for us to address and why we focus so much on having young people work on some of these policies and work on some of the ways to address this.
So with the dawn of e-cigarettes and vaping, there have been doors that have opened for us in terms of policy because local decision makers and even state decision makers are realizing that this is a huge problem. And it helps when the FDA is saying the same thing. So I want to focus a little bit on the successes that we had in 2018 at a statewide level. In 2018, the legislature decided that it was time to eliminate the sale of tobacco products in pharmacies. Previously, CVS was the only pharmacy that decided by itself to take tobacco out of its stores, but you could buy it in many other pharmacies. So now, as of December 31st, this has become state law, and we're very excited about it because many 84 chapters did a lot of work on this issue in particular. Also, including e-cigarettes in the smoke-free law. Again, this passed this went into effect December 31st, 2018. There were no regulations as far as where e-cigarettes could or could not be used, and they weren't included in the state smoke-free law. So now, anywhere that you can't use a cigarette, you also can't vape. And finally, raising the minimum purchase age of tobacco to 21. We're one of the only states that has done this to this point, and that's really because the lawmakers recognize what a huge problem this is. And the 84 was instrumental in this, especially at the local level, because that's where we work on policy work. So to kind of give you an example of something that we're still working on in terms of local policy, I want to show you a couple of different maps. This is a map from 2015 when we started working on local flavor restrictions. So flavor restriction, when I say that, I mean that any flavored tobacco product can only be sold in an adult-only retail establishment. So in the green colored areas or towns, that's where local municipalities have decided that they don't want their flavored tobacco products to be sold in corner stores or gas stations. They want them to be sold only where adults can enter the store. So this was back in 2015, and we have worked with 84 chapters all across the state to try and increase the number of flavor restrictions in the state. Here's a map of 2016. So as you can see, there were more towns that adopted this policy. And 2017, and finally 2018. So ultimately, right now, there are 126 towns out of 351 in the state that currently have this policy. And if you think about it in terms of years, this was over the course of 3 years. It's not bad for 3 years of work when there's also been a lot of awareness that has helped increase and helped move the policy along. And again, young people have been at the forefront of this, and they really knocked on doors of municipalities that had closed doors about this topic. There were many towns on this map that weren't even thinking about updating their regulations, but because members of the 84 sought them out and got on the agenda and said, listen, this is a big issue to us. A lot of our friends are using flavored cigarillos or vaping. Then the legislators actually listened to them, and they got their voices heard. So this really, I think that these maps really illustrate how local policy in towns can help move a state forward. And we'll wait and see if there's a statewide policy eventually that gets passed. So our priorities for this year are on the screen here. We have a lot of things that we still need to do. Even though the policy wins that we've had, especially in the last year, have been great, there's still many things that need to be done. And I would just like to say too that if your town doesn't have all 4 of these priority policies and you're not in dark blue on this map, if you want to get in touch with me and get your young people involved in our program via this route, then I'm more than happy to walk you through kind of what could be done in your town. Tobacco is very interesting to me because it really truly is a place where local decision makers are listening to young people. And that in turn has a humongous impact on the development of those youth and them feeling like they belong and also like their voices can be heard. So in terms of youth development work, I feel very strongly that this program really does help youth find their potential and using their voice to make a town a better place to live. So in terms of what we've done with the state and kind of where we've seen a shift in the past year or so, MTCP has been really instrumental in training us on racial equity. So we have shifted the way we are looking at our work, and we try to do it with a racial justice lens. This has permeated throughout several different areas of our programming. So for example, with our trainings, Natalie ended up developing a couple new trainings that focus specifically on how the tobacco industry targets people of color, and also how tobacco is very intertwined with racism and has been since this country was founded. So tobacco, in particular the menthol cigarettes and the promotion of menthol towards communities of color, that's a huge racial justice issue. So we've been focusing a lot on that, both in our trainings and then at our statewide programming. We've been training young people along with us and educating them on how these two issues are connected. And we've seen a great response from that. In terms of our mini grants, we have mini grants where people can do a mini grant on a racial justice topic or on local policy. And we've seen that the racial justice mini grant was given to almost all of the groups that applied for it last year because that's what people are interested in. So when we think about how to connect to young people where they're at, this is a place that we can do that. And also it's the right thing to do. We're not just doing it so we can work with more young people. Okay.
Great. So as Carly mentioned, we use a youth development approach. She sort of alluded to that in the previous slide. So now that we've given you a little bit of background about our program and kind of what the state of tobacco prevention looks like in Massachusetts, we want to talk about how we do this work. So how do we even engage these young people in this tobacco prevention efforts? So we're going to talk about the youth development approach. So as you can see here, the definition of the youth development approach is a process by which youth develop the personal, social, academic, and citizenship outcomes necessary for adolescence and adult life based on their capacities, strengths, and formative needs. So everything we do in the 84 is based off of this youth development model. Many people think that in order to achieve different prevention outcomes, you really have to focus in on something particular in order to make a young person, not do something or prevent them from engaging in a risk behavior. Like, for example, many leadership programs focus solely on academic outcomes, but the youth development model focuses on areas to build skills of young people, which ultimately lead them to not engaging in risk behaviors as a byproduct of that. So if we're focusing on the whole youth and all these different aspects that young people bring to the table, we're really able to get to that prevention effort more successfully. So we focus on a lot of these with the 84. So what the areas that we focus on in youth development for the 84 lead to some achievement-based outcomes like getting a job or a scholarship, going to college, or problem-free outcomes like not participating in crime or becoming pregnant when you don't want to. And the way that we start and sort of focus on those things is by looking and focusing on these developmental skills. So by helping young people build some of these skills that you see listed here, like their leadership skills or their social skills or just their sense of responsibility in their own community, you're really helping them get to the some really positive outcomes. So that's kind of what we try to build our program on with the 84 is how can we help young people get these skills? So how can we help them engage in their community so that they feel a sense of responsibility, civic engagement? How do we help them feel a respect for their environment and the people around them? So really helping do that through a tobacco prevention lens is what we're focused on in the 84. And like I said, when we're focusing on those developmental skills, it leads to these positive developmental outcomes. So the more a young person feels that sense of responsibility and ownership, the more that they're going to achieve some of these outcomes in terms of self-awareness, self-worth, and even some of the other like more concrete ones like physical health or intellectual ability are great outcomes that happen when we're focusing on those positive developmental skills. So I know that, when we're thinking about youth development model, it might be a little bit like, it might seem like really complex, but it actually is quite simple. If we're focusing on these skills with young people and focusing on the whole young person, we're able to help youth move closer to these positive developmental outcomes. So how do we do that? How do we actually focus on those skills and get youth involved in them? Well, we have to invite them to participate. We have to get youth to participate in our programs in order for them to get to this place where they're getting to those developmental outcomes. So we're going to talk a little bit now about the various levels of youth participation and go over some examples so that you might see how that could be applicable to your programs and coalitions. So here I'll just start with this general graphic. So here is what we're talking about with these levels of youth participation. Along the bottom, you can see all of the different sort of names for these levels, from none to tokenism all the way up to self-managing. And we're going to go over each of these levels so that you have a concrete example of what each looks like. But as you can see, the further right we move on the graph, the less adults have power and the more youth have power. What I want to make sure and point out here is that this is a continuum of youth participation. This is not to shame or blame any programs for where they are on this continuum. It's not to say that because maybe your program is a tokenism or because sometimes you focus more on consultation, it doesn't mean that that's inherently bad for young people. It's really just about thinking how to move one step further, how to get from one level to the next. It's not about going from no youth participation to self-managing overnight. So just really trying to be gentle with yourselves when you're thinking about how to involve youth in your programs. So that first level that we're starting with is none, and it's pretty self-explanatory. This level means that no youth are included in terms of the planning processes or when you're deciding the work that your coalition is going to be doing. There's no youth that are being consulted or engaged in that process. So this could be, you know, making a poster without asking young people, or sometimes it also could be, you know, a presentation. So we get asked occasionally to do presentations about the work that the 84 is doing. And sometimes it's not always possible to involve young people in those presentations. Sometimes it's during the school day, or sometimes it just doesn't enough time to have a young person engaged in that. So unfortunately, no youth are involved in that. It's not to say that that doesn't happen to some of us, but that's just the reality of how it is sometimes. So that's really what that none participation level looks like. The second level is tokenism. So this is really about adults setting the agenda and making all of the decisions and inviting one or two young people to sort of be consulted or even just be visible, but not really having the young person have a lot of sort of say or in how the program is going or what the presentation or anything is going to look like. So the adults are really setting those parameters. So an example of this, and like I said, this is to say that none of these levels are inherently bad. This is actually a picture of one of our statewide youth leaders, Sarah Ryan, speaking at a recent press conference standing next to the Surgeon General. It was a Surgeon General's conference on vaping, and they asked Sarah to come participate and sort of share her story as a young person who works on this issue. This would be an example of tokenism, but as we all might be able to tell, this is not a negative thing. This was actually really wonderful for Sarah. It was a great opportunity for her to go and be asked to speak alongside the Surgeon General and to tell her story, but it would be an example of tokenism because we only have one young person here speaking to what young people are seeing in their communities, standing next to a bunch of adults. But sometimes that's just where the opportunity is. So this could be an example of that. The next level is consultation. So this is about adults consulting with young people, but still within the parameters that they are setting. So the adults are really calling the shots, but they're consulting with young people to try and add some parts of their opinions and thoughts into the programming. So this could be talking about an event that perhaps the adults are setting and organizing and setting the theme for, but maybe asking young people and consulting with them on specific content things or ideas about the event. So a great example for us in the 84 is our statewide youth event called Youth Power Summit that we have in the fall. So this is an event that is sort of our kickoff event every year, and we provide workshops and trainings for all of our chapters. But we do often think about the theme and work with our funders to think about what is most appropriate in terms of our priorities for our program for the year. So there are certain things that we set in place for that event, and then we consult with young people to talk about specific elements. So this is sort of a little bit of a more collaborative effort, but it is still consultation. So before we move to the next step, I'd love to do another poll here. So basically, we just want to get a sense of what you all think in terms of an example and where we see the level of youth participation. So the poll is: a board of directors for a hospital in a town is having a meeting. They have no youth programs at the hospital, but invite a youth intern to their meeting. This would be an example of what? A, no youth engagement; B, tokenism; or C, consultation. All right, so we're gonna just give you just a little bit longer to enter your answers. Alrighty. So it looks like the majority of you said tokenism, and that's correct. So this would be a great example of tokenism. We're talking about a hospital that maybe doesn't have any youth programming right now, but perhaps is trying to think about what that could look like. And oftentimes a natural place that folks think to start is to invite young people to a meeting like we're talking about here. So yes, that's a great example of tokenism.
Okay, great. Thank you, Natalie. So we are moving right along on this continuum of youth participation, and now going to move and talk about representation. So representation is where there are a select number of youth that are put forward in front of their peers or maybe to decision makers, and they're representing a part of the program or maybe all of it. So a good example that we have with the 84 with this is on Kick Butts Day. On Kick Butts Day, every year at the State House, it's either in March or April, where we bring in about 200 young people to meet with their legislators about how the tobacco industry is influencing their community. So they are, oftentimes there could be a group of 5 or maybe even 10 of them that go and speak with a legislator or legislator's aide in their office. So this is a really good example of representation where they are speaking kind of on behalf of their peers, but it's not like everybody's coming to this event. There's just a select group of them from whatever they're doing in their school or community. And the legislators listen to them because they present the information in a way that they can understand. Something that I want to mention too is that oftentimes on legislative visits either at the State House or with local decision makers, I've seen that legislators don't know what's happening in high schools very often. And so when young people come in and they give their opinions or ideas or experiences from their high schools, it's something that is very unique for an adult to hear and to listen to. So I think that there's a lot of power with youth voice, particularly when it comes to the civic process. And we see that via the representation of them speaking with their legislators about policy. So next is the level of participation. And this is really, we're kind of getting into the meat and potatoes of where you can see that youth have more power than adults in this particular case. So they really are starting to set agendas. They're starting to come up with the ideas. They really don't need that much help from the adult in the room. They are generating what they want to work on and where they want to put their energy. So this happens a lot with our program. Each chapter of our program is very different. So there's different needs in every different community. And so we see that play out by what the group decides to work on. It's totally fine from our perspective because we recognize that there's no one size fits all for youth programming on a statewide level. And also we want to encourage that young people have this level of control within their particular program. So Evelyn is going to come on in a few slides here, and she's going to give some examples of youth participation in her program, which her program, I would say, is really a model for other 84 chapters because of the level of youth participation and self-managing that they do. And so you're going to hear it directly from her as far as an example for this. And so finally, the self-managing category is when youth are really doing it all themselves. Youth really have a grasp on how to run a meeting. They oftentimes will assign themselves different roles, maybe elect different positions within the work that they're doing, take on different tasks according to their own strengths and desires. So this is when the youth kind of just run the show and take the ball and just do what they need to do. And this has happened in a lot of different cases across the state with policy, in particular with the 84, which is great to see. It's wonderful that youth recognize the problem in their community, oftentimes by doing some sort of a needs assessment or focus groups or talking to people in their community and seeing what the problems are. That's kind of where it can oftentimes start. And then they come up with an action plan. They make their own recommendations of, all right, this is what we're going to do about it. They set a timeline. they come up with ways to keep people accountable for whatever it is they're doing. And then ultimately, in our case, which we're focusing on, a lot of times it turns into a policy that's passed. And so then what happens after that policy? Well, they might need to continue doing awareness raising work and educate the community on kind of how the law has changed. Also, just continue to build that support, because once a policy is passed, the last thing you want is for people to go back on that policy. So young people, when they're at a self-managing level, they're extremely high functioning, and the adult just kind of sits back and watches. And you might be saying, well, I get paid to do this. Shouldn't I need to have my hand in the pot a little bit more? And the answer is really a big fat no. Really, this is an ideal of what we would like to see in any youth programming, where the adult isn't doing much or anything at all. So I think it's important to note that even if a group is self-managing, they're definitely going to be looking to you as the adult as like a support for them, either emotionally, or maybe they want to bounce ideas off of you. But they know that you're there. And if there's that trust there, then that's the most important thing, because they will come to you if they need you. But the goal is for you to be able to say, okay, you are more than capable of handling this. So go right ahead. So now I'm going to turn it over to Evelyn Rodriguez from Lawrence, and she's going to walk us through really the Lawrence story. Lawrence has an incredible story from the time that Evelyn came on board and to kind of what it looks like now is a very different situation. And I think that is in huge part to her young people that have just taken the reins and said what they wanted to do to make their community a better place. So she's going to kind of walk us through from the beginning and kind of talk through how she moved on the continuum from one side to the other. So Evelyn, without further ado, if we can unmute you, and we'll take it away.
Well, hello everyone. Glad to be here. My name is Evelyn Rodriguez. I'm the Drug Free Community Coordinator from the City of Lawrence.
Okay, Evelyn, go ahead and try speaking.
Can you hear me now?
It seems like we're having a technical issue with Evelyn's phone. One moment, please.
Hello? Hello?
Evelyn, we can't hear you, so I'm not sure if you're able to call in. Oh, one moment.
Hello? Can everyone hear me now?
Welcome to Zoom. Enter your meeting ID.
Okay, I'm sorry. It was because my computer was muted, so I'm sorry, Evelyn. We can actually hear you. Can you talk now? Evelyn? Oh, she might have gone to get her tech person. I'm sorry for the technical difficulties. Evelyn, can you hear us?
Hello?
Evelyn?
Is that better now?
Yes, go right ahead. Okay, I'm sorry about that. Take it away.
It's quite all right. Thank you everyone for your patience. So my name is Evelyn Rodriguez, as you already know. I am the coordinator for the City of Lawrence. I started this coalition initiative in 2015, where Diane Knight was a member and introduced me to the amazing Chapter 84, or the 84.org, I should say. In 2016, I then opted to initiate a chapter in the city of Lawrence, where I started with 5 youth participants. That quickly increased. We ended up getting a mini grant for the policy change to help restrict the sales of flavored tobacco products after attending our first Youth Power Summit. And upon that training, the 5 youth participants came back to the high school and spoke about how much they learned and how much they enjoyed at this Power Summit and how much this program would make a difference in their lives, because this program was in fact a program where they can actually see themselves doing things and creating change and making a difference in their community versus just in their school. So they wanted to do things more outside their school. They want to make change. They wanted to make changes in their school community, but as well as in the community as a whole. So this was ideal for them. They came back, they shared with probably the entire 9th grade class in an assembly, and the youth participation quickly increased from 5 to about 88 at that point, 65 to 88 students at that point. Then we, that summer, we ended up administering the surveys in the city of Lawrence. We ended up with 15 youth participants throughout that time. We helped they administer how to request the information from the bodega owners and how to kind of explain where they were coming from and their perspective as a youth and their concerns as youth, and to speak to them in about the availability and accessibility in the city and how they view that as a huge problem. This became a huge interest among the community. It became a huge interest for our Board of Health. A lot of our Board of Health members had no idea of the accessibility or availability in our city until the youth went and told them and went and showed them the data they compiled. A lot of them were unaware of the health risks due to these flavored tobacco products. They were unaware of how accessible and available the e-cigarettes were and how they were promoted or placed right next to candy, aside from all these flavored tobacco products already being enticing to youth. They were readily exposed to them. These youth then continued to meet with the Board of Health consistently for a year. Throughout that year, we continued to take in a lot of data into the meetings. We compared the neighboring cities' data upon their adopting these policies to the city of Lawrence. And it was a quick eye-opener for all of the members of the Board of Health when the youth said that 90% of our bodegas had all of these flavored tobacco products available to the community. So you didn't have to walk no more than another half a block from one bodega that already had these products to another that has the same one. So they compiled this data. It was very visible to the eye, so that was more impactful to the Board of Health members when they saw it than comparing the impact to the other neighboring cities who have already adopted these policies and the great change when it came to infractions or underage sales. The decrease in all of the above in those neighboring cities was impactful enough for them to say, okay, something's got to be done here. So while they discussed all these concerns, they continued to mention a lot of the also drug paraphernalia that was also being sold along with these e-cigarettes, like hookah pipes and glass pipes. And those were encased in glass, like bookshelf casings, as soon as you enter these stores. So aside from one of these policies being introduced by them, these concerns being introduced by them made suggestions to add on 2 more policies. So the second policy added on to the first, which was the restriction of sales of flavored tobacco products, was that of the restriction of sales of hookah pipes and glass pipes in bodegas as well, both to be sold only in 21 plus tobacco retail stores. The third that was also added to this, being that it was all a smoking prevention policy initiative, was that of restriction of smoking on-site construction sites to prevent those preventable fires that start because of inappropriate distinguishing of cigarettes, right? So all 3 were added together, were put together in this suggestion or this policy. And lo and behold, after a huge meeting of great attendance, there were at least 200 plus nightclub owners, managers, and business owners that attended the meeting in July, where it was discussed to propose, these proposed policies were discussed, and it was discussed to try and pass it. All the kids testified. We had more than 20 youth attend and testify, plus parents, grandparents, and coalition members. We even had individuals from the Andover and North Andover Cities Board of Health that came and attended and also spoke on the greatness of this policy being adopted and the changes that it makes in their communities, which helped our argument and solidified their youth concerns. So
well, if I can, I'm so sorry for interrupting, Evelyn. If I could just ask if you have your computer volume on, if you don't mind muting it, because it's there's some people who are having a hard time hearing you.
It is muted. I'll kind of just stand away from it, and hopefully that'll stop the echo.
Okay, and then take your phone off speakerphone if it's on speaker and speak directly into the mic.
Okay, sounds good. So they continued with the argument on in July, and as of August 14th, the vote passed unanimously with all 3 members voting to pass all 3 stipulations. Since then, the motivation and inspiration in these youth has probably increased tenfold. They have, through the training by the 84.org and through the extensive data that they get from the training, they have been able to create policies within the school so that rather than being suspended or having, let's say, an e-cigarette, they come into our program and do about 6 workshops to kind of just gain an increased knowledge on the effects of e-cigarettes. So they've been able to create these policies with the help of the principals at high school. They've also been able to do things on their own, such as walkout towards, the gun violence. It's stuff of that nature. Just leads to the leadership development aspect or perspective of the 84.org. The Board of Health members have now become advocates of their work. So now going back to trying to set a cap on licenses this year is going to, we're hoping, is going to be a lot easier, where they already have the knowledge on hand and the data that they have compiled on hand has been helpful for them to come to a must in our community, and we're hoping that this will be just another success for our youth. A lot of our youth now, the newcomers, we have about 188 chapter right now, 188. So this is from 9th to 12th grade. We have 10 what I called advisors, and those are the ones that have been with me since 2016. These kids pretty much do everything on their own. They set the agenda for the meetings. They kind of get into, they do little things where they decide, okay, what's like the big topic to discuss right now? What should we be prioritizing right now? And then they move forward with that and bring it to the bigger meetings with all the key participants and start discussing what their next project would be. They also train the newer youth leaders on how to do their workshops, and how to, let's say, host a table in the community, and how to provide the information about the program. So that's where the self-management and maybe the participation, so those two levels differentiate and come into play. I've always just been there to kind of guide them along the way. If they have a question, I give them with maybe 5 easy answers, and lots of times they go into makesmokinghistory.org or the84.org and get a lot of their resources and information compiled from that. But there's very little that I have to do at this point, 3 years into it. It of course, as Natalie says, I'll reiterate, does not happen overnight. But again, we've attended 3 these power summits where they've gotten so much training there. We're consistently downloading resources and updating any information that we receive from any of the resources that we've gotten from the Department of Public Health, which helps them also just communicate the message a lot better and be, all of them need to be kind of on the same page, and that message needs to be and clear. So that's really important. And they, my youth lead advisors are very clear on that and very good on providing these trainings to the newcomers, where to the point where they feel so comfortable doing skits in the middle schools today on any type of just leadership development. I think that's probably about it in my story, besides the fact that since the passing of these laws, which will be effective February 15th, so we're looking forward to all of this being taken, all of these products being taken out of the local bodegas. We have had a lot of buzz in the media as of late between Lawrence Eagle Tribune and El Rumbo and a lot of the local smaller newspapers come in all the time to speak to the kids. Right now, we're actually partnering up with 2 other youth serving organizations and just getting into radio stations and getting the message across the Merrimack Valley, trying to further our reach, to more youth and more families on the importance of getting these products out of local bodegas, out of the reach of our children, and just letting them know that one is not better than the other. If not, they're all equivalently dangerous. So thank you all for your time and allowing me to share my youth success stories.
Wonderful. Thank you so much, Evelyn, for sharing all of that with us. It's truly quite a story with how it all started and just how the young people really found this to be an issue that they wanted to focus on. So I think it's really interesting too, just the differentiation between the participation and self-managing, and how once people got involved in the program, that Evelyn really took it from participation to self-managing and kind of let them do their own thing. Whereas if there are new members of the chapter, then Evelyn shepherds them a little bit more until they get the hang of things and then kind of lets them fly. So I think that's a really good approach to youth development, and also it has proven to work, and the proof's in the pudding. When you have 188 people in one high school who are participating in a tobacco prevention program, it might be a surprise, but tobacco prevention isn't the most exciting for a lot of young people. So I think when you get to that level and there are 188 different people that are part of the group and are like begging to be a part of the action, that's when you know that it's the youth. It is the youth that have taken over and they have created something out of it. So congratulations to Lawrence and to all of your young people, Evelyn. And as we can see on the screen here, I just love this article so much because the very first sentence of the article highlights that this was because of youth that this policy got passed. A lot of times the media will not mention youth or not recognize that they were an instrumental part of it, but because of the efforts of the Lawrence crew, there was no way that the media could deny that the whole reason that this came to be was because of them. And I will also say too that Lawrence was a place, I've been doing this job for 5 years, and when I first came here, Lawrence was kind of like a hands-off type of city because we had not had success talking to the Board of Health or getting them to update their tobacco regulations in quite a long time. And so to have these young people kind of build it from the bottom up and then to get this recognition by the local newspaper, it's a really big deal. And I think it is a true testament to what youth development can do, and also speaks to what Natalie was saying about those developmental opportunities for young people. So on that note, I'm going to move us into another poll. So you can see it on the screen here. It's kind of long, so I'll read it out. A local gym wants to increase the number of young people using its services. They contact the high school, and a group of 5 students on the student council come up with an action plan and decide to focus on seniors and want to give them a discounted membership as part of their mental health week at school. They present their idea to the gym's executive director before moving forward. Would you all say that this is representation, participation, or self-managing? The poll is going to pop up now, so please submit your answer. Give just another few seconds, so get those votes in. All right, the majority of you say participation, and that is correct. The reason that it's participation and not self-managing in this case is because the executive director was the one who called them in the first place. The youth didn't come up with this idea, right? Or they didn't come up with the idea that they wanted to promote the gym services. The gym executive director came up with that. And then also they had to check in with the director before they moved forward on their idea. That shows that there's still power that the adult is holding. A lot of this is really meant to break down adultism. And if you've never heard that term before, it's exactly how it sounds. It's adults thinking that they're better than young people because they're adults, and also not giving credit to young people where young people could perfectly do the job themselves. So in this case, there's no reason that the youth couldn't have come up with their own idea to connect with the local gym and try to increase youth membership. And maybe that's happened in certain towns. So young people, I think, really add a lot when it comes to ideas for things like recruitment or retention. So we just need to ask them and give them that power, and they'll come up with the solutions themselves. So speaking of kind of what the benefits are of the youth development approach, number one, it is beneficial for young people. It promotes a rich cultural diversity within a coalition or program, because youth are a part of our world and our community. And so by including them, we're diversifying the ages that are represented within our programs and organizations. And this really does speak to adultism. So rather than speaking for young people and saying, oh, I know that this is what young people would like, so let's just do it this way, we actually include them in that conversation. And a lot of times we can be wrong if we just kind of assume what young people think might work. That's happened to me before too. So I think trying to just dismantle the fact that we're all adults and not look at young people like they're inferior, it takes practice, and you'll start to kind of have these flags that come up with things that you might make a decision on or things that you say or do. And those are the critical moments where you know that your chip is starting to change and you're starting to see young people in a different way. another benefit is that youth development really promotes choice and opportunity towards the achievement of participants' full potential. So when youth are given opportunities, they seize them. They want to be a part of the action, as was evidenced in Evelyn's presentation. Also, the youth development approach ensures that coalitions and programs have relevance and flexibility. So when young people are the ones directing where the programming is heading, that is definitely going to increase their engagement in the program and their sense that they actually belong to something really meaningful, which in turn actually also makes them feel like they're included and that they're not being discriminated against, A, because they're youth, and B, because their voice is or that is seen as being inferior, when we know that that's not actually the case. So all forms of discrimination are challenged, and you'll often hear young people who will call you out on certain things. If we had it actually recently with some youth that we know saying, well, how come this person gets to do the interviews all the time? So when there's discrimination, you can bet that a young person's gonna say, well, hey, I want a piece of that pie too. And so that's what's great about having youth voice, because they're not gonna let adults just kind of give all of that pie to one person, which is great. Also, this leads to retention. When young people feel that they're engaged in the program and like they actually matter and that the things that they want are coming to fruition, then they're going to stay in your program. So your retention rates are going to steadily increase and then hopefully stay at a good level. We've had on the statewide leadership team, just to give you an example, we've had the same youth from freshman year to senior year just because they care that much about the program and they feel very invested in it. That's another thing too. It's great to have freshmen involved because then they tend to want to stay on board for longer the more they feel invested in the program. Another reason that using this approach that Nellie and I walked you through is because there are a lot of benefits to you as adults. So when we think about our role as an adult who's getting paid to do this work, a lot of times after a certain amount of time, your ideas might become a little bit stale. You might be thinking of the ways that you've done things in the past that seemed to work before. Maybe it produced great results 5 years ago, so you want to try it, do it again. But times change fast, and so sometimes you need fresh thinking. Youth are very good at that. And so they're great at breaking adults out of this boxed in way of thinking and also keeping it fresh for you so that it's not going to become boring if you're in the same role for 5 years. Just like me, for example, I've been doing the same thing for 5 years, but every year the youth continue to amaze me and bring me more job satisfaction because I include them. Also, when youth are included, their respect for you is going to increase. I've had multiple young people say, I am so glad that my voice matters here, which it doesn't in a lot of other arenas of their lives. So if you can find a way to give them a voice, whether that is via tokenism or consultation or representation or participation, that's wonderful. Any way that you can infuse young people where they're not infused right now is fantastic. One of the ways that we do it too that we haven't mentioned so far is with hiring. When you hire new people at your organizations, do you have youth that are part of the resume reviewing? Or do you have youth come up with the questions of what should be asked? Do you have them participate in any of the interviews? We've done all of that and found it to be really beneficial because youth have a way of seeing through people and can read their skills and can see who's going to be a good fit for a position. And it, in turn, is also building leadership skills in them and giving them something. And practicing for interviews is a great skill for young people to have as well. So also, just you're going to feel more successful if you are including young people in your programming. It will reflect better on you because if the young people are engaged, they're going to be coming to your program over and over again. Your program is going to have a fresh look all the time, and that's a good look for you. So I really encourage you to include young people because it will reflect back on your own success. And finally, let's talk about the benefits to the community. We talked about civic involvement a little bit earlier, and that's one of those developmental skills that Natalie walked us through. And civic involvement is something that young people are great at, but oftentimes don't have an opportunity to even know how to go about doing it. So for example, if it weren't for the 84, many of our youth would have never met with their legislators. They don't even sometimes know who their legislators are before we kind of show them where to find that information and set up the meetings for them at the State House. And so when they feel connected to their legislators, they're definitely going to feel more engaged in their own community and want to continue to kind of see what they can do to make their community a better place. Again, with youth promoting or youth being contributing members of their community. So for example, last night I was at a Board of Health hearing in Ashland, and there was actually 3 young people who came to speak, one of whom was connected with the 84. And I swear to you, you could have heard a pin drop in this room when these young people spoke. It's like their words in these Boards of Health meetings are so much heavier than any other adult in the room that's just kind of giving their opinion. And I asked her after she spoke, I said, how did you feel? How did that feel, giving that testimony about how the tobacco industry is infiltrating your community? And she said, I felt like they really listened to me, which, I mean, what more could you want? That is exactly what you want. And she was asking me questions all throughout the public hearing. And so I could tell that she wants to be part of the community. She wants to learn kind of how the local government work. And I said, well, what are you thinking? What are you thinking of doing? And she said, I want to go into politics. I mean, this is where young people can be led either by themselves or with the help of adults that are supportive along the way. And then finally, the benefits to your community, it increases engagement opportunities for community members and vendors. So think about the poll that we just did about the gym's executive director. I really don't think that any Boston sports club, for example, here in our city, are thinking about, oh, let's contact young people to see how to increase teen involvement or teen membership at their gyms. But my question is, why not? The young people in the city of Boston could definitely contribute great ideas to increasing their membership or making it more enticing for young people to join Boston sports clubs. So I think maybe thinking outside the box a little bit about who you can connect young people to is a great place to start. So think of the local businesses in your town that don't have anyone who's kind of helping them along. Last night at the Board of Health meeting, for example, there were a lot of tobacco retailers there. And one of the suggestions that was brought up is instead of the windows outside of the corner stores and gas stations being plastered with tobacco ads, why don't they plaster them with health messaging instead? So can young people be a part of that? Can young people go and talk to members of the community and even in the same neighborhood as them to say, okay, what can we do to make this a healthier place, and where can we infuse our own voices as young people? So we've gone over the levels and the continuum of youth involvement, and we've talked about the concrete example in Lawrence and now the benefits of what this could do for your town and community. So now I want to talk a little bit how to actually go about doing that. How do you start moving from one step to the next in what you're doing? And Natalie's going to go through that with us.
Hi, everyone. So as Carly mentioned, in terms of how to really take everything that we've talked about so far and the levels that we've described, how do we concretely put those things into action? What are some concrete ways that we can get youth involved? So we're going to go over some of those right now. So the first things we have here, number one, assessing. So one of the things that we think about in the 84 and when we're starting to get young people involved in tobacco prevention in their communities is how can we have them even understand what's going on in their community in the first place. So typically one of the first steps that we do is think about how young people can go out into their communities and assess it, talk to the people in their communities, do some type of survey, engage in different evaluation activities so that the young people are able to understand what is happening in their community before they even start this work. So that's a great way to get youth involved. It doesn't have to be adults going out into the community and asking community members what's going on. That can be young people. A second example or a second way to do this is in communication. So a lot of times we think as adults and the way that our kind of society is programmed is that any type of more formal communication, especially when we're talking to decision makers or legislators or presenting to folks, we all, is kind of conditioned to believe that adults need to do that. But that's not true. And as a matter of fact, young people are often much more engaging than adults in terms of in communicating and speaking to those folks. And as Carly mentioned, oftentimes they're bringing a different perspective that is not heard a lot of the time. So it's really helpful to give them those opportunities to be the ones communicating on behalf of your programs. The third on here is implementing. So when we're talking about creating programming or leading different activities or workshops, again, we have this mindset that adults have to do that. Adults have to lead the programs. Adults have to present the workshops or lead the field trips or even hire staff. When in actuality, youth can help implement those things. Young people can help implement the programming that you all have. Young people can do the presenting of workshops. Young people can interview and make decisions about who should be hired in your programs. They have a voice in that just as much as you do, and they have stake in that too. Another thing that you can think about is choosing. So when we're talking about choosing, we're really talking about how to select the parts of your program or specific aspects of your program that might be beneficial. And as Carly mentioned before, a lot of times we sort of get stuck in this bubble as adults where, especially if we've been doing youth work for a while, I often find myself thinking that I know what a youth is going to say because I've worked with youth for so long. So I'm like, well, I know that they're going to want to do this activity over this activity, so I won't ask. But that's a dangerous sort of mindset to get into. No matter how long you work with young people or how many times you've asked that young person to weigh in on something, it's still important to continue to do that because you may never know what that young person says. You're never really going to know what their opinion might be until you ask. So a lot of times, even if we think that we know, or even if we've asked them the same question before, we'll ask young people in our program again because we might come up with a different result this time, and letting them choose those things. Another big thing that I think is oftentimes hard for youth programs or just programs in general, especially sometimes depending on where you're getting your funding from, is allowing young people to be involved in decision-making processes of your programs. And I'm not talking about, small decisions every once in a while, like what should our Snapchat filter be, which it is true, we have asked youth for that too. But I'm talking about even more everyday, regular decision-making for your program. A young person, youth can tell when they're being asked for sort of those fluff questions or being handed like a fluffy decision to make, as opposed to real decisions that are impacting the program. They can see the difference. So inviting youth to all levels of that decision making is really important. I mean, in schools in a lot of states, students serve on comprehensive youth councils as really active members alongside adults, deciding on tobacco and alcohol policies and other public health concerns. For example, in Hampton, Virginia, youth serve on every city commission as full voting members. So that's a really concrete example of decision-making being put into action when we're talking about youth participation. And the last one to mention here is that planning. We've mentioned it before in terms of our youth events with the 84, involving youth in the planning of those events. We've often thought about how to have youth be involved in setting some of the content or helping design some of the workshops, but even some of the other parts of planning, like how do we, plan for buses? How do we plan the setup of the room? Those kind of logistical things. Some young people want to be a part of that too. We have young people on our statewide leadership team who don't like to speak in front of groups, who don't like to be the ones to co-facilitate, but they do like to participate in the logistical planning of an event. So how can you have young people be involved at each level of that planning is important too. An example of this could be in Ontario, Canada. Youth have been hired as peer leaders to work in each of the 50 public health units and are involved as staff in the planning of activities for tobacco and violence prevention, physical health and nutrition promotion for the province, and focusing on peer education in their communities and schools. So, you can see that it doesn't matter the type of event you're doing. It doesn't matter the level of your program. We're a statewide youth tobacco prevention program, but as you can see in some of the examples I've given, there's ways to do it in schools. There's ways to do it in terms of a city commission. There's ways to do it in an entire community or province. It all depends on what you're willing to do. And honestly, going back to that adultism thing that Carly was mentioning, how much power you as the adults are willing to give up, how much power you're willing to give up to the young people, trusting that they can handle it and are fully capable of doing so. So now we're kind of reaching the end of our webinar here. So we want to make sure that we go over some of the things that we talked about. We've gone over so many things in this webinar. So we thought it might be helpful to talk about some key takeaways and to just sort of do a recap for you all here. Honestly, ultimately, there's so many different ways that you can engage youth in public health programming. And the main thing that I possibly want you to take away from this is just start with one question. How can I include youth more? How can I include youth more in what I'm doing? When you're sitting at a table, when you're planning your next event, when you're having a meeting, when you're doing anything with your programs, ask yourself that question. How could youth be included more in this? Is it possible for us to have more youth at the table? That is always the best place to start. And I guarantee you the answer is probably yes. There is more room for young people to be involved. And you can just think a little bit more critically about how to do that. The second the kind of third takeaway here to think about is if you're struggling with those questions, if you're struggling with, okay, yes, I'm asking how to get more youth involved, but I don't really know what the answer is, the best place to ask somebody is asking youth. Ask the youth how to get them involved. We've mentioned several times that we often get into sticky spots when we assume what youth are going to say, or we assume youth don't want to be involved. I wouldn't have thought, 3 years ago before I started working with the 84 that young people would even be that excited about being involved in tobacco. And that would have been a horrible assumption on my part entering this work. So, even when you're thinking about the different works that you're doing in your coalition, you might think that it's not something young people are interested in, but you're probably wrong. There probably are young people that want to get involved in those things. They just have never been asked. So asking them is a really important place to start. So through all of this and by allowing young people to choose and to make decisions and planning and assessing and communicating all of those things, there's always a way to kind of move up on that continuum of youth involvement. Like I said before in the beginning, even if you're at no youth participation right now, that's okay. That's, there's no shame in that. There's no blame in where your programs are at. It's not, you don't want to force any of this either. So even if you're at none, just thinking about how to move one step up to tokenism. How can we move that one step? How can we move the meter just a little bit closer to the other side of the continuum is success. And as long as you're thinking about always how to move one step further, is really the place to start. So that's sort of a recap for us. We're going to go ahead and share a little bit of resources with you now.
So before we move ahead to this, I got word that Evelyn had something to add on this slide. So Evelyn, go ahead and unmute yourself.
Can you hear me?
Okay, Evelyn, you're unmuted.
Okay, great. So I just wanted to add to this recap real quick that asking the youth for their questions or their concerns or their wants is very important. This is where they've realized that their interest is bigger than what I even anticipated. I am so guilty for assuming that our youth here in Lawrence were going to be reluctant to the tobacco prevention. where my coalition works on prevention as a whole, I figured tobacco was going to be the more reluctant one to find youth to participate in because of the fact that kind of vaping and smoking is so glamorized in our city. I've been fascinated by this work and fascinated by what they've learned through this work, to the point where I have one youth that has not only become a statewide leader, but also a national ambassador for Tobacco Free Kids campaign. So the interest is there. It's just guiding them to the projects, the efforts, and the movement, and then allowing them to kind of run with their ideas and giving them that power, as you could, power and guidance, of course, these differences for the whole. I think it has been a great resource for our youth, and it has promoted growth in all of them. I believe that by next year, we have several of our youth applying for college right now already, and using the 84's experience as a huge highlight in their college applications. So this organization and this movement opens the doors to many other opportunities for these youth, and I feel that allowing them to grow within it is a huge factor to keeping them with us and keeping them at a growing pattern.
Thank you so much, Evelyn. I so appreciate that point of view and perspective. And I think it's a great reminder also that we're all guilty of adultism in some way, shape, or form, and we have an opportunity to work on that change ourselves. So I'm going to move us into resources. So here are just a couple of websites that might be helpful for you, including the 84's website. And then also the last bullet point I want to point out is where you can go and look and see what policies are in your town, what tobacco policies are in your town. So if that's of interest to you and you kind of want to take this issue on, then we would be more than happy to work with you. So on that note, if you want to connect with us on social media, here are all of our handles. We would very much appreciate you doing so, and we'll try and promote your stuff as well. Note that on Instagram, there's an underscore after the 84 movement. So just kind of be mindful of that and make sure you're adding the right one. But other than that, you can just type the 84 movement on pretty much any platform and you'll find us. And now we're going to move into questions, which I know that there have been several that have been asked from the participants of this from the beginning. So I'm just going to kind of go over those and answer some of them, and we'll see what we accomplish. So if you can write any of your questions into the chat box, now's the last moment to do so. And I'm just going to kind of go down the list. So the first one is about resources and kind of mentions that the 84 seems like a really robust program with a lot of staff. I have to say that although we do have staff people that run it at a statewide level, it wouldn't function without the local level happening. So Evelyn is an example of an adult advisor that has taken this issue on as part of her current roles and responsibilities in Lawrence, and that's how it is in every state. Okay, so in every city. So basically, all these adult advisors already have their full-time jobs, and they do the 84 work as a part of that. So we don't give money out to folks as stipends or anything like that to run the program, but we do offer mini grant opportunities that sometimes people will apply for, and I mentioned those in the beginning of the presentation. So we are actually in an open enrollment period for mini grants right now. So if you work with high school students and want to get involved, we are giving grants up to $4,000 out. And oftentimes what people do with those, and what we encourage and highly recommend in cases of people who work with us on mini grants, is that they do give stipends to the young people. So with that $4,000, we want at least half of that money going to the youth. Youth have a lot of priorities, and if they don't get paid to work on a particular project, then sometimes that can be a huge financial stress on them and their families. So we try to offer those opportunities when possible, but we don't actually pay anyone else. We don't give money just because they're part of the program. All that said, the programming of our organization is free. So all of our statewide events, trainings, any activities that we put on our website, all of that's free. So once you're part of our program, you're kind of in for life, and we're happy to take care of you and come out and talk about what the best strategies for your town might be. Somebody asked about Kick Butts Day, which is coming up on April 3rd. We haven't opened registration yet, so you all are in plenty of time to sign up for the 84 today on our website and then come to the event. It's free, and we provide transportation and food, so you really can't go wrong. It's during a school day, so we do have youth come out of school, and we have a permission slip for that. But it is an awesome experience for them, as I think we highlighted enough during this presentation, and we'd be more than happy to accommodate your youth for that event. There's really no strings attached with the 84. You can use it as much or little as you want, or as is best for your program. So if you meet once a week with young people and want to include the 84 in that, then great. If you just want to come to our statewide events and maybe do an activity here or there, that's also fine. This program is very flexible because we use the youth development approach, and that's what it's all about. So yeah, we are happy to meet you where you're at and where your young people are at. Another question about the slides. Yes, you will be receiving a recording of this presentation via email once we finish here today. So if it wasn't enough for you to watch once, you can watch it again and again and again. And I think we answered all the questions that are here. Oh, we have one other question. The difference between representation and participation. Okay, so let's go back. Well, I'm not going to go back to the slides, but representation is basically where there's equal power between adults and young people. So you might have youth actually working with you, collaborating with you to make a decision. And there could be as many adults as there are youth. That's how that could look. Or it could be that adults have as much time on the agenda as young people have. That's what representation would be. So they really are power sharing in that situation. With participation, that's where youth are starting to take more of the control. So the adults are really stepping back. They're letting the youth come up with the agenda, kind of allocating what they want to work on, who should get time for what, how things are going to flow within the organization or whatever project they're working on. And there's a good number of them that are working together on that, where the adult is really starting to take a back seat. I see that as the main difference between those two, where one is really sharing 50-50 power with them, and the other is where you're really taking a back seat. Maybe you're in the passenger seat, and then self-managing is when you're in the back seat. Any other questions? Okay, I'm going to put our contact information up here. So if you would like to contact any of us, please do so. I think Evelyn's a great resource as well if you want a local perspective on kind of how she got involved in the 84 and the work and specific examples of how she increased her youth participation. And I know that the adult advisors in our program love connecting with each other and hearing about what other towns are doing. So please feel free to contact us. It's been a pleasure being here with you today, and I'm going to pass it over to Daisy to close us out.
Thank you so much. Oh, sorry. Thank you so much. Sorry about the echo. Carly, Natalie, and Evelyn for this wonderful presentation. And thank you all for coming today and for your wonderful questions. The 84 is a wonderful program, and we hope that you are able to tap in to all the wonderful resources and the youth energy that they have going on. So we are gonna follow up with some more information, so look out for that email. And in case you are interested in what we have coming up next, we have a content planning for social media, online training that will be led by Tamaki West. And again, Natalie Cashin will debut again, because another thing that the 84 does really well is their whole social media presence. So we will be learning about how to be intentional about social media in that online training. So we hope you will join us, and we will have more trainings coming up as well. So we will share that if you're on our email list. If not, please add yourself, and we will make sure you get that information. Before you sign out, we have some questions to share with you. We would love your feedback. So please take a couple minutes, less than 5, to give us your feedback. We really would appreciate your input. And thank you again for your participation and all the work that you do. So again, hopefully you're seeing the poll on your screen. Please take this quick survey for us before you head out and start your busy day or continue your busy day. And we appreciate all your feedback. So we will officially be signing out. I'll leave the poll up for folks, but thank you again. And we hope to see you at the next one. Bye, everyone.